called to order. Per bylaws, section 14, committee attendance. If any member of a standing or a special committee of the board will not be present at a scheduled committee meeting, the member may ask the chair of the board to request that another board member, not a member of that committee, attend the scheduled meeting and be counted as member for purpose of quorum and voting. Jose Pagan has designated Frida Wang to attend this committee meeting and be counted as a member of purposes of quorum and vote. Thank you, Frida, for joining us. Next on the agenda, I would like to have a motion to approve the minutes of Information Technology Committee meeting held on November 1st, 2022. Thank you. Let me poll every member. Dr. Katz?
Yes.
Ms. Lowe?
Yes.
Ms. Wang?
Yes.
Thank you. It's approved. Next, we will have the CIO report.
Thank you very much, Mr. Chairman. Today we'll be presenting our April 3rd update of information technology. We can move to the next slide. Related to that, I did want to introduce my team. Also, for the first time, we have Catherine Thayer with us, who is our new Chief Application Officer. You might remember previously we had Sean Koenig with us. Also with me is Zipporah Vicaria, Shoma Badori, and Jeff Lutz, our subject matter experts for the day. So we can go ahead and move to the next slide, will be fine. Thank you. So I'd like to kick off with just a really brief overview of our goals for the fiscal year 2024. You can see that we're looking at 5 key domains, and part of today's presentation will be kicking off several different areas within these goals, and we will continue to do that. You might also note that each one of the goals and the domains are aligned with the strategic pillars, and all are aligned with the mission, vision, and our values for H&H. The first area on the next page, please, is an update of our data center migration. Just, a pause here. This was a 24-month initiative where we were transitioning from 2 data centers to 2 new data centers. The first one was complete at QTS, which went live at the end of September of 2022. And going in collaboration with that, we were moving to our second data center, which is Cyrus 1. And our deadline there for our project would be the end of May 2023. As of the end of March, we are 92% complete on this transition to complete the second data center. And we are on target and on budget for this transition. We will be live with the new data center at the end of May, and we will have some transitions for Epic towards the end of September. We can move to this is actually just a visual of the timeline. We can move to the next section. This has actually gone live, and at least at King's, it kicked off already. This is our transition to Epic's new browser, which is called Hyperdrive. And the first go live actually went very well, and we are planning to go enterprise-wide on this by the mid-April of 2023. So just right around the corner here. It is a new web-based client that was developed by Epic. It provides the tools for Epic to continue improving functionality within our environment. And it also simplifies the upgrades for us by decoupling from the environment.
Kim, is the current Epic Pro an older version of the Explorer than what we use now?
So
someone recently, I just got an email about looking something up, and the medical director pointed out, oh, I know that we go to an earlier version of the Explorer. Does that ring any bells?
Well, what this is it's
they're
the back end,
different.
it's the development tools that they've used, basically to present the interface that you're using. So it's built in something called Visual Basic, which was very popular late in the 90s. And now they're moving to a browser-based, it's made off of actually Chrome. version. So it'll allow us to deploy quicker. But yeah, what you're looking at, the Explorer, it's a very legacy. Interface is the best way to put it. The user experience shouldn't change much, but it'll actually allow them to do better and tighter integrations and a bit of a smoother experience of what you see on a web-based type of application these days.
But I also think, Mitch, I'm not sure if you were referring to Epic in general or just to, overall the feel that you have when you go online, because there is definitely the Chrome and then the Edge that we have right
Yes,
now.
no, I see those. There's something that when you're within Epic and then you go to something else,
Yeah,
the links pull on an older version of the Explorer.
they were at one point, but those should be gone by now.
I think they're still there,
Okay.
at least as of the most recent memo on
This
that.
is the user experience.
Yes.
I have a question about that.
Sure.
Have we ever married any elements with the labor daily, the nursing staffing? I've often thought to get staffing right, you have to have that kind of intelligence.
Actually, there is capability there, Ms. Lowe, and once we move into the new advanced scheduling system in UKG, we will be able to take advantage of that functionality that, and this is, in concert with Dr. Senius, our chief nurse, that we will be able to look at those levels of complexity of the patient and the staffing.
That's wonderful.
Okay, we'll be moving along to our clinical applications. Here, three key areas I wanted to mention is our transition to bring Epic Community Connect, which is an instance of New York City Health and Hospitals, Epic to DOH-MH, as well as speak a little bit about Epic Business Continuity. We have a new product from Epic, which really gives us the data so we no longer have to use paper downtime in this area. And just a little highlight of some of the upgrades we had over the last quarter. So the first area is looking at our transition to support DOH-MH as they move from their variety of federated electronic health records. I think they may have 5, Catherine, you could correct me, to have one single instance of New York City Health and Hospitals Epic. By doing this, we will be extending the ambulatory component as well as revenue cycle and also reporting. There are some dependencies with DOH-MH. They will be bringing on their own version of Cerner Lab, as well as the Office of Technology and Innovation will be providing the support for their network as well as the hardware. There will be some interfaces that we will need to provide to them, particularly in the areas that are unique to them, such as their HIV, tuberculosis, and the immunization registries that they maintain on an ongoing basis. You can move to the next slide. Right now, we are underway in this area. A lot of discovery has been done. The kickoff has happened. We meet on a weekly basis, if not more often. Catherine Thayer and her team are leading this charge, and our anticipated go live is October of 2023. Sorry, not my voice. We can move to the next area, which is, I really like this, and having been a previous chief nurse, I love having the capability of knowing the data of individual patients, as they're moving, the admission, the discharge, and their transfer in the event of a downtime. So this new component that Epic provides to us helps us maintain that data even while our system is down. So we can keep up to date on the patient census. We'll have a capability of understanding where that patient is and no longer have to do that on paper. And then when the system comes back up, we'll be able to transition that data back into Epic at that time. So it really has a nice safety feature as part of our business continuity action plan. You can see on here, we're actually going live across our system with a completion by the end of May 2023. Any questions there? Our next area is, we can move to the next slide, is just to provide an update because it's been a month or so since we've been here. We can move there. Next slide, please. Just that we did complete our Epic and Cerner upgrades at the end of the previous calendar year, which was the end of October of 2022. We also completed our Epic Wisdom, which is the dental product within Epic, and moving off of Dentrex. And as well as we had our final go live at the end of February 2023 of Epic Willow, which is our outpatient pharmacy.
Kim, I've seen data on the impact of Willow across the pharmacies. It's quite impressive. Basically, what's sort of interesting is they didn't turn it on at the same time.
Yeah.
So you could see the improvements based on how recently they had turned it on. And the, very high compliance with the right rules, the ones that had turned it on a while ago. And because I immediately said, what's wrong with Elmhurst? And the answer is they hadn't turned it on yet.
Yeah.
And you could see the whole, so the Willow seems to be a big success in making the outpatient pharmacies run better.
Yeah, and you're right, it does take a period of adoption.
Sure.
If you will, and we do have training and additional training if people need support for that, but it has been actually quite successful.
Who touches this, Willow? I mean,
It's a pharmacy,
okay.
right?
And the doctors who make the orders, the inputting?
It takes my order and turns it into a label for the bottle of medicine, and it enables the pharmacist to quickly be able to fill the prescription for the patient.
And it populates so the medication person can see it as
Correct.
well.
Correct. All automatically without any, having to retype anything.
So wonderful.
Right, and it goes to our outpatient pharmacy. Right, so we could support the patient as they're being discharged.
Wow, that's
Like
that's
this.
it.
Okay. Our next area is, I'm so happy to be speaking about this particular area. This is our new biomedical device database. It's called Nuvolo. It'll sit on top of our ServiceNow software. This is, as we have started looking at our security across our system, from an application and operating system perspective, one of the key areas that we are fully aware of is the potential within our biomedical devices. And so this particular software will allow us to add all of the biomedical devices into our existing database, which is called the CMDB, or Configuration Management Database, and then connect those together. So if there is a particular software that we have, how does that connect to that particular biomedical device? So this is something that we are rolling out. We are partnering with our biomedical device vendor, which currently is Crothall, to support us in bringing together this inventory. In addition to that, we also are launching, as we move forward, a common ticketing system within ServiceNow. So if there is an issue with one of the devices, that we will be able to have that ticket go into ServiceNow and then be able to track that with transparency across the system. So it's in its infant stages right now. We're partnering with Crothall to help us, ensure that we have that built out as we move forward. And then I highlighted some of the benefits here. I think, having the ability to remediate any security exposures is one of the key things for our particular area, or Shoma's particular area, if you will. Also, having the common incident management system is very important to us. And then in addition, when we're looking at strategically replacing devices, is that we look at several different things, not just the age of the device, but the security characteristics of the device as well, so that we can make the highest priority decision based on vulnerability. So those are some of the nuances that we'll be able to take advantage of when we get this fully rolled out. Our goal is to work towards July on this. We have a single, infant version of this going right now. I am going to actually close with, hitting some of the highlights or awards or accomplishments of the team, which is always a fun thing to do. Jeff, I might let you do this particular one. This is our Best in Resilience certification. I'll set the stage for you that we currently use Everbridge, and then a product within Everbridge is Alertus. So this helps us during our emergency management or any kind of crisis that we may have to communicate across the system.
Yeah, thank you, Kim. And briefly, we were recognized by Everbridge out of all of their customers, and in the relation to the standards that they set up around these types of notifications and leveraging their product as a best in excellence, and being gold certified. So put us essentially in the top 6% of their customers, up there with other customers like Siemens, Intermountain, Johnson Controls, and as Kim had mentioned, we use it for not only our notifications during a outage or a large event, but the team has been closely working for, as well as including things like our on-call scheduling, as well as even in the facilities of our STEMI activation at Jacoby. So it's a great recognition and a great job to the team.
And the STEMI activation is, something that we could actually expand across, our system. So they really set the vanguard there, if you will, at Jacoby for utilizing the system for that particular activity. The next area I wanted to highlight was the nomination of our Project Management Office, our PMO, which was part of the 2022 Amazing Employee of the Year nomination. We can go. So I'm very proud of this team as well, but I did want to highlight, what do they do? They are the people who pick up any project that comes into our system that will need support. It could be something as small as an optimization or something like the data center migration that can take 24 months to achieve. We can go to the next slide. We thought that in 2020, with all of the changes that we had in response to COVID, that we hit a real high number of 2,313 projects that came through for this particular service line within IT. But if you look at, we've actually continued to progress. This past year in 2022, this particular group managed 2,415 requests across our system. And then I'm so glad you're here, Ms. Lowe. I'm going to close with the final highlight, which is we held the 10th annual conference for Nursing Informatics Council, and that was held on December the 9th. And so it was done virtually this for the last couple of years and has been quite successful in that format. And I will close there.
Well, I have to say, when you bring nurses together and put technology in front of them, they're terrified sometimes. I think we've turned that leaf right now. But when they become familiar with the uses of technology, it builds their practice and make it stronger. And it's wonderful. Absolutely.
This is an amazing group. They're not just in IT. I will say that the group of nursing, we have a Nursing Informatics Council that they are representative of all of the different facilities across the organization, including Gotham Correctional Health, et cetera.
Yeah. We were relying on the advisory board in Washington, which was good. Matter of fact, the lead person thought I was his labor and delivery nurse. His mom told him that's the woman who helped me deliver you. It may have happened. I was at Mount Sinai at that time. So it was a nice, he gave his all to it. And we saw some savings in our staffing, and it improved the nurses' feeling about the job and management of the patient. So thank you. Thank you for just kicking it up another notch, several notches, actually.
Thank you, Kim, for sharing and the presentation, and also for the timing of condensing the presentation. We appreciate it.
You're welcome.
So I wanted to ask Dr. Katz, do you have any further questions? Thank you. Ms. Lowe, any further questions?
Bravo.
Thank you. I just have a couple, if it's okay. I really think that it's so important, this downtime web data entry, in terms of allowing the nurses and the physicians to continue doing while the system is up. But looking at the conversation that we have a couple months ago about data protection and encryption, I assume that all this data, even though it's going to be separated from the system, will be locally encrypted just in case that particular unit were to find its way outside of the hospital system.
It's still within the Epic system? Yes.
So it's all encrypted, even though it's separated from the main system. It's locally encrypted, or it's only remotely.
It sits actually locally, keep me honest, right, at the facilities. So it's a server that sits within, right on our network. It's just outside of the data center, but it still falls within all of our all the same security and encryption and everything else to us. It just, in the event that the system's unavailable in the data center, it still provides that level of access for them at the facility.
Oh, this is only in the case that you lose connection to the data center, but you still have access to the system in the facility? Or is this the type of cases that you lost all connections and you only have I think you're talking about those mobile units that they go to the bed of the patient. Is that correct? Where they type information and collect data about the patient?
Right. So part of the business continuity access is if the system would go down and you're no longer able to, let's say, go into Epic and you were not able to document, across all of our facilities, we have a printer and a device where the information is backed up to that so that and it keeps that. And I think it's refreshed every 30 minutes, if I am correct. And it keeps the pertinent key information of the patient on that database, separate and distinct, so that in the event that we needed to, let's say the whole city lost power, we would be able to, on generator, go to that particular device and be able to print out. It actually becomes manual in that case, print out what the patient's medications were, some of their key information, their allergies, why they're there, et cetera. And so we would that is part of the business continuity access. In addition to that, one of the other areas that we did do fully on paper and not have a system of backup was when the system was down, even during a planned go down, if a patient was admitted or they were discharged or they would transfer, someone in the admitting office would have to actually manually track that. And then they'd have to go at the end of when the system came back up, they would have to go and then reconcile all that information. So I might have been discharged, but I might still be in the system, when the system came back up. So what this new component does as part of our continuity is it actually keeps that live. We don't have to do it on paper. We're able to have this component within Epic, and Catherine, you could probably speak to it better than me, that will be able to keep tracking the movement of the patient. So it doesn't have to be tracked, and then it just eliminates the cumbersome process of reconciliation at the end. I hope that helps.
I understand that process. I think what I'm trying to get a clarification, because I had one idea, but I think what you're explaining is something different. So I just want to make sure that I understood what it is.
But the data is encrypted.
No, but that's okay. That I will ask that again. But is that the data, it is the local repository. What I had in mind was that it was in the actual portable unit. That means if that portable unit were to be disconnected, you still can put your information, will be there. When it connects back, it will consult. But I think what you are saying is that there is not the case. What it is there is a local facility server that the units have to do. So if a unit gets disconnected, they don't have local repository to save the data. That's what I'm trying to understand. Where is the local repository? At the unit level or at the facility level? I think you mentioned at the facility level.
It's on each unit, actually.
It's each unit. So in theory,
You want to talk about the
BCA computer, so the first one is local to every unit.
Okay.
And then what this provides is for the ability to, as Kim had mentioned, there's a central repository. So it's a web page. So they would open up because Epic is no longer available.
Mhm.
So this opens up a web page then for them to continue to update the status of the patient, whether it's discharging, admitting, or any other type of transfer. And that then gets synced back into Epic once it becomes available again to us. So it's right, it's internal and it's local for each facility. So they have their patients that are admitted at that time.
Okay. So this connects to the local at the facility level,
Right.
but not at the unit level. So the unit will not be able to collect the data if it is not connected to the
So
facility.
the unit still collect the unit, but it's a different repository. It's a larger repository as opposed to the unit specific one that's also there. There's also a unit.
So
specific one.
I can follow up on that. I think I want
I
to go into
understand
more
that.
detail.
We probably.
The caring of the patient is at the unit level.
Yeah.
The movement of the patient is at the facility level.
And these tool that you presented today have the ability to collect it at the unit level and at the facility level, or only at the facility
At
level?
the facility level.
Only at the facility level.
You
Okay.
can tell he's an engineer.
I was thinking about like printing out the sheets, for
Yeah.
the medications and things like that.
Well, I have a
A
question.
visual is always helpful in this case. The Visio.
I'm profoundly struck when I'm watching television and there's all these hiccups these days. And I feel like, oh, there they go again over there in Russia.
All these what?
Hiccups, horrible ones too, and frequent. Should there be anything major happening in cyberspace and we are affected, and let's say the night nurse sees anything going on, before she sees it or while she's seeing it, how does the system alert and block activity, suspicious activity?
That is a very complex response, but I will say that Shoma and Jeff, and if I could just simplify it, we have 24/7 monitoring going on at multiple layers of within our system. We have a multiple layered defense mechanism
Nice.
for our system, and then any one of those could trigger off an action for someone to take a deeper dive. But the system itself can also contain. So before the human gets involved, the technology will also support the containment of whatever a potential nefarious agent is until we're able to decide, that it is or it isn't. I hope that was simple enough.
But I think Ms. Law brings something. I think we discussed it when that incident happened of one of the systems that went down, that maybe have an educational session on the cybersecurity for the board and kind of go over the different levels, the redundancy that we have, and all that. I think that may leave. I don't know, Ms. Law, if that's something that you might be interested.
Oh, yeah. I'm always concerned about the weaknesses and such, I was at the front of trying to get technology in front of the nurses at Woodhall, and it was really early on. And they were frightened, but then they had similar questions like, can anybody else see this? And think very simple questions. So there's always going to be a concern, the vulnerability of any one system.
It would be our pleasure to, actually, I know Shoma has something she could pull out today to show us, but we would be happy to do that for the board.
Yeah, I think that may be interesting, again, with all the things and how TV sensationalized cybersecurity. I think it would be important. And the second question is following up on Dr. Katz's kind of praises of Willow, how Wisdom, how that implementation has gone. Have we seen also major improvement? Did we use similar approach to Willow that were like in phases so we can see how one dental clinic is doing versus the one that doesn't have Wisdom? I don't know.
Kathy, you want to expound on that a little bit?
We did follow a similar approach in that we did do a phased implementation. So we went live with our first set of sites July of last year. We were able to take some lessons learned, work through some, anything that came up through our support process that we have, and apply that for the next round of sites that went live in October with the upgrade. So we did have that structured approach provided that support and saw improvements on the workflows. And to Kim's earlier point, we're able to stabilize during the adoption period.
Thank you. Interesting.
The dentists like it.
Right.
I've spoken to the dentists.
Oh, they like it?
They like it.
Okay, that's wonderful because it's so
Images as well.
it's so important. Again, I just want to say congratulations to your team. I know that you have had testing time through COVID, but I think it's impressive how you continue to service the whole organization, support new initiatives and new demands, and how quickly you responded. So I'm glad to see that your team was recognized as an employee, as one of the nominee for Employee of the Year, and also the number of demands that you kind of met and exceeded. So I just want to give thanks to you and your team for being out there. I know that sometimes you seem to be like the back office that nobody really see you.
Thread.
Yeah. But, without back office, there is no front office. So I think that's the
You
important.
should see when the computer goes down, everybody freaks out.
Yeah, I know.
So if they're in the
Bill,
back
everything.
office, if they're in the back on when things are running, when things stop running, wow. So like nobody can remember how they ever took care of a patient before there was an electron. What do I do now?
They become the patient. The Tourette's that go on is unbelievable.
Yeah, I can imagine. So, Frida, I don't know if you had any questions. Or...
Thank you.
No, thank you. So I just want to say thank you for the team. Any old business? Any new business? There be no further discussion. All in favor of adjourning this meeting?
Aye.
Bye.
Thank you.
Thank you.